Hi, this is Congressman Joe Courtney from Connecticut's 2nd District. I'm speaking to you from the Longworth Building in Washington, D.C. Today is March 5th, 2020. Last night, yesterday evening, the House of Representatives voted 415 to 2 to pass a emergency spending bill to address the coronavirus challenge that our country now faces. Again, 415 to 2 shows that this was a bipartisan effort. The president came out with a package on February 24th. Congress came together, House and Senate, to change that package, and hopefully within minutes or hours, the U.S. Senate will adopt the same bill and send it to the president for signature. So number one, I just wanted to give you that quick update. Out of the bill, $8.3 billion, a large portion of it is devoted toward developing a vaccine, which fundamentally would be the best way to address a new illness like coronavirus. Again, it's going to take some time, but there's certainly some encouraging developments in terms of some research and development that's happening out there, and this will turbocharge that effort to speed that along. Another large portion of it goes straight to states and local governments who, again, are in the front lines of dealing with calls, with individuals, patients who are concerned about whether or not they actually have this condition, doctors who are making referrals. So the first, I think, effort and portion of resources is devoted to making sure that there is a testing capability so that people can, again, provide whatever they need in terms of specimens for testing to take place. The state of Connecticut's Department of Public Health will be, for now, the sort of locus of where tests will be submitted and processed. Again, CDC, based on a briefing I just had this morning, has sent out 75,000 kits all across the country to sites like the Hartford Public Health Department. That number is going to multiply dramatically over the next week or two, so that there will actually be millions of test kits that are going to start, again, to get out into the communities. There is, I think, real movement that's starting to happen here. On February 27th, the state of Connecticut Public Health Commissioner Dr. Coleman came and visited me, again, just a few days ago in my office in Rayburn. And again, we talked about the fact that the federal government is really critical in terms of providing the funding so that, again, people at the front lines are going to have the resources that they need. And then, again, they are on standby tomorrow in Norwich, Connecticut, March 6th. We're actually going to be holding a roundtable where the Department of Public Health will be participating, as well as local providers in the southeastern and eastern Connecticut region. Again, to talk about this new measure that just passed, also get feedback in terms of what's happening at the local level. In addition to those two sort of buckets of funding that came through the bill, money is going to come through to community health centers. Again, we've in Eastern Connecticut, the two primary federally qualified health centers are United Children and Family Services, Generations. Again, there's a recognition that as patients experience what they think are symptoms of coronavirus, that's certainly going to be an entry point into the public health system, and we want to make sure that those centers are up and running in terms of having, again, the best information and training in terms of how to deal with patient requests and patient referrals, and also the resources to make sure that they can, in fact, deploy what needs to be deployed in terms of making sure that tests and treatment take place. Dr. Azar and Tony Fauci briefed us this morning again about the fact that, again, the hotspot, the highest concentration right now is in the west coast of the country, as I think all the media reports have demonstrated, state of Washington, state of California. But frankly, no one can be complacent about the fact that this highly transmissible illness could, again, move and grow in different parts of the country. So, I think efforts by CDC to get information out, to give guidance, particularly to healthcare providers in places like nursing homes, where, again, as we know, the highest concentration of affected patients has taken place, is now underway. My office is going to assist in that effort in terms of making sure that good information is available. If you go to my office website, You can find a COVID-19 tab that, again, has the latest updates from CDC. What is coronavirus? A very good explanation of that. Good advice to people, to patients who think they may have the conditions. And again, we are going to be holding public events like the one tomorrow in Norwich to continue this process of getting information out to Eastern Connecticut and the state of Connecticut as broadly and intensely as we possibly can. One last point, I think when the vote took place last night, there was a recognition that this was really sort of the first wave of federal response to get out to the states and to the researchers to develop strategies and therapies to counter coronavirus. It's not going to be the last effort. And again, there's a whole host of secondary issues in terms of protecting our healthcare workforce, about dealing with issues of insurance coverage so that tests and treatments and therapies are in fact covered. The Medicare program, I think, is now going to really open up telemedicine so that patients will not have to leave home to get advice and treatment and patient interaction with healthcare providers in the safest, quickest way possible. So again, we will continue this process of making sure that people are given the most up-to-date information about what's happening out there from our briefings down here in Washington, and making sure that you have an avenue to share with me your thoughts and your experiences so that, again, as a nation, we're at a time we just have to rise above politics. We have to rise above territorial, state, and local distinctions and really work together to make sure that we address this challenge that obviously is something that people are concerned about and should be, and that as a country we move forward. So thank you for your contacts with our office. We welcome it and encourage it. And again, go to our website to get the latest updates from CDC. Thank you very much.